Okay, so welcome and thank you for joining us to another webinar in the NYSCRC series for professionals who work with caregivers. Just a little bit of housekeeping. If you would like CEUs for this event, please be sure to identify yourself by putting your name and email in the chat. In the event that you're using someone else's phone number or log on, but we did have a little glitch with our registration, so some registered through Zoom and we didn't capture whether or not you wanted CEUs, so please let us know in the chat box. Please mute yourself until the end, where we will open the program up for questions. However, feel free to place questions in the chat as the presentation is in progress, and we'll circle back to them at the end. This video is being recorded and will be housed on the NYSCRC YouTube channel as well as on the website. And if you are experiencing any technical difficulties during the presentation, please chat to Sharon Cackett, and she will do her best to get you connected. And now we're pleased to share two outstanding respite programs in New York State. So next slide, Sharon. So so today we welcome both awardees for the Arch National Respite Innovation and Exemplary Respite Services Awards. We are very proud of these two programs and the work that they've done, and we hope that you can learn a lot from them today. So just so you understand the significance of these recognitions, a little bit about ACL. Next slide, Sharon. ACL the Lifespan Respite Care Program was authorized by Congress in 2006 under Title 29 of the Public Health and Service Act. Lifespan Respite Care Programs are coordinated systems of accessible, community-based respite care services for family caregivers of children and adults of all ages with special needs. These programs reduce duplication of effort and assist the development of respite care infrastructure at the state and local levels. Lifespan Respite Care Programs work to improve the delivery and the quality of respite services available through using the following objectives. One, expanding and enhancing respite services across the state. Improving coordination and dissemination of respite services, streamlining access to programs, filling in gaps in services where necessary, and improving the overall quality of respite services currently available. So Arch awards programs every year, and they're usually given at the Arch National Respite Conference, which, if you remember, last year was held in Buffalo, and it has been postponed until June of 2021 next year. So they awarded these programs and put all the information out online, and because we're so proud of our New York programs, we want to share them with you. So the award criteria was using an evidence-based or evidence-informed approach, having written goals and objectives, having program service manual or guide to facilitate with the replication, offering person and family-centered services, having a professional development plan, having an evaluation plan and collecting the data according to that plan, and being sustainable as an organization. These are very high criteria. So staff at the present time have all worked in the field of aging for a number of years. They are coached in working with volunteers and problem solving with families through regular staff meetings. The original team consisted, and I believe this is the Lifespan program, consisted of a nurse, social workers, volunteer coordinator, and program manager, all with experience in working with older adults. So I would like to introduce Eve to you. And Eve is going to present for the first program at Lifespan, and then when Eve is done, I will share some information with you about Kim Comiskey, who is with the DOH grant up in the North Country. So Eve Moses is the caregiver coordinator of the Finger Lakes Caregiver Institute Partners in Caregiving Volunteer Respite Program and the Monroe County Caregiver Resource Center at Lifespan of Greater Rochester. Eve has many years of experience in supporting older adults and their families in the Rochester area, including as the executive director of the Generations Social Adult Day Program, education coordinator with the Alzheimer's Association, and Elder Source care manager at Lifespan. Eve is master trained in Powerful Tools for Caregivers, which is a nationally accredited evidence-based program, along with her co-workers. Has recently created a new curriculum for family caregivers called Unlocking Joy in Dementia Caregiving. Eve is also master trained in the REST program, Respite Education and Support Tools, and works with the New York State Caregiving Respite Coalition. Her 6-year experience in developing Lifespan's Helen L. Morris Rochester Area Community Foundation Respite Program has brought a wealth of knowledge to the topic of supporting caregivers. So Eve, we welcome you and take it away.
Thank you. Okay, so the one slide is supposed to be the replication manual.
Photo of the manual.
Yes.
There you go.
There it is. So while Sharon is trying to work through the PowerPoint, I'm just going to start by talking about how this grant began. Okay. In 2013, feels like a million years ago now, a report called Caregivers in Crisis, Why New York State Must Act, was based on a national caregiver study that ranked New York State 48th out of 50 states with regard to support for family caregivers. New York State came in almost dead last with respect to support for caregivers. And it was vital information because 80% of all long-term care in New York State was and still is being provided by family caregivers, not by formal care systems. So that really said something. It was not a good report card for New York State. So at that time, a group of local professionals, I'm in Rochester, New York, upstate New York, for those of you who are not with us, in the Finger Lakes region. And a group of local professionals came together to look at why our caregivers felt the way that they did and what could be done to help them feel a little more supported. There it is, the replication manual. Thanks, Sharon. We have copies of this manual if you would like it. Just let Doris and Sharon know in the chat. So this group of professionals came together, and the group included members of the staff at Lifespan, Rochester Area Community Foundation, Community Place of Greater Rochester, Catholic Family Center was there, Monroe County Office for the Aging was at the table, the University of Rochester Strong Memorial Hospital was also at the table, along with the Alzheimer's Association, and a group called Causewave, and their former name was the Rochester Ad Council. So one of the key caregiver issues discussed was the need for safe and affordable respite options so that caregivers could take a break or have some respite time. And this is how Helen L. Morris, Rochester Area Community Foundation's Caregiver Respite Grant at Lifespan began. So let's talk about collaboration because it's key. You want to look at what programs, if you're thinking of starting a program like this up, you want to take a look at what already exists in your community, what respite programs exist, whether they're identical to what you may have in mind or not, what exists in your community. So in Monroe County, Community Place of Rochester, a nonprofit organization, had a senior core grant that had been in existence since 2000. And this portion of the senior core grant was called the Senior Companion Program. And they were providing respite to urban families, more of the inner city families, primarily Spanish speaking. They were often at capacity and unable to provide additional volunteers for requests for respite. So they were maxed out. So Lifespan, through the Helen L. Morris Rochester Area Community Foundation grant, collaborated with Community Place and provided additional funding for them to continue serving more families in the city. So because of the nature of their program, they were not reaching families in the suburbs or rural areas of the county. And as a result, we drew some very loose lines or boundaries or catchment, as you might say, catchment areas for each of the programs. So Lifespan recruited volunteers to serve suburb and rural family caregiver requests, and Community Place continued to serve the city with additional volunteers. So while Community Place and Lifespan each had their own orientation, The volunteers from both programs were required to complete a comprehensive training, which included working with the Alzheimer's Association, so that all volunteers were trained in understanding dementia and handling communication and behaviors of care receivers. We wanted to make sure that all volunteers had a good knowledge base of the disease process, not just those who were in the earlier middle stages, which is primarily what we were serving. Volunteers also met regularly to share ideas for activities with care receivers or to problem solve any issues that might have arisen. Along with staff support, these volunteers were supported, and they supported each other through regular meetings. A lot of our volunteer staff meetings was just time for the volunteers to talk about what their experience was. They supported each other in that way. They helped each other through. Caregivers were encouraged to attend Powerful Tools for Caregiver classes that were offered by Lifespan. And through those classes, caregivers were linked to other services through Monroe County Office for the Aging Caregiver Resource Center, through Lifespan, Catholic Family Center, Elder Source Care Management. And the way that they were able to attend those programs is because their volunteer would come and be with the care receiver so that they could go and learn more on how to help themselves. So there was a lot of collaboration of services and the Alzheimer's Association with support group and education. So I'm getting to the details of the program, but I'm touching on each of these topics first. We're going to see a little video in a minute that talks about a match. But basically, the match consisted of a volunteer being matched with a family. That's what we're going to talk about. But then the family and the volunteer would come together, determine a time that worked for both of them, for the volunteer to visit, and spend anywhere between 2 and 4 hours once a week to relieve that caregiver to do whatever it is that they needed to do. So prior to all of that happening, there was a fair amount of training that went on. So the original staff who were responsible for the volunteers and families had worked in the field of aging services for many years. They were coached in working with volunteers and problem solving with families through regular staff meetings. And the original team consisted of a nurse, a social work, a volunteer coordinator, and a program manager, all with experience working with older adults, caregivers, and people with memory loss. The training was a little bit different for Lifespan volunteers versus the community place volunteers, simply because the criteria for the senior core programs at Community Place was different from that of Helen L. Morris. However, there were many aspects for both that were the same. The volunteers for both programs went through an orientation, which included the option to become an RSVP volunteer, retired senior volunteer, if they were eligible. And what this meant was they received additional benefits for becoming an RSVP volunteer and volunteering in our program. In the training, we also required a background check to be completed, permission for criminal history background check, sex offender registry check, and in New York State, the Department of Motor Vehicles has something called a LENS check. It stands for License Event Notification Service. There's a little charge for the LENS check, but it's well worth it to determine if someone is safe to be in the car with one of our volunteers, and our volunteers were allowed to drive their caregivers and the care receivers in their own vehicles. So we did want to make sure that, we were being careful about that with liability. Also required by all volunteers was a 4-hour dementia training, which was provided by the Alzheimer's Association. And this is included, the understanding of memory loss and dementia and the different types of dementia, effective communication with persons with dementia, and understanding different behaviors and how to handle those. So volunteers were matched with families and made weekly visits that lasted for 2 to 4 hours. And the volunteers then turned in monthly timesheets with comments about how their time was spent with the care receiver and any issues that may have arisen. Staff then followed up to resolve any issues and to answer any questions. So that's how our ongoing communication was happening with the volunteers to help support them. Volunteer meetings also happened quarterly. I believe it was monthly for the folks at Community Place, the volunteers at Community Place, but we did quarterly staff meetings, and the staff meetings always contained an education component. So it was ongoing education, as well as giving the volunteers an opportunity to talk about what their experiences have been. Okay, so now I'm going to show a little video, and this is a video that was created in the first year of the grant. That was in 2013. And it describes the program and is an interview with a caregiver and a volunteer who were they were one of our very first matches with the Lifespan Respite Program. So I'll let you go ahead with that, Sharon. Thank you.
I think caregiving is so much harder than we realize when we first undertake it. She came at age 99 and she's now 3+. We dropped the 100 a number of years ago. It's just a lot easier. She was a school teacher and then raised a family of 3. She's seen a lot of things, and she likes to tell stories about all of those things. Caregiving, unless you've done it before, personally, I don't think anybody can begin to realize what it's all about. Meal planning and house cleaning and all the things that you do ordinarily, but add that to trying to take care of somebody who became more needy. She would call to me often, and she was somewhat bedridden, and so I was doing a lot of stairs. I live in a split-level house. It was not headed in the right direction. It was not going to be. I was probably headed for a breakdown myself.
What I see here in Rochester is that caregivers are doing all that they can to try to keep their loved one in a safe and happy place. No one wants to have to institutionalize. Often, the caregiver is the last one to realize that they're stressed and that they do need some help.
I had an appointment with my own family doctor, my primary physician, and she is my mother's family doctor. And she could see that I wasn't thriving very well. And she said, I think it's time to bring some more help in for you because you've been caring for your mother for a number of years now, almost single-handedly. And she was the one who recommended Elder Source Lifespan to me, and I got right on the phone. And it must have been fate that we connected when we did, because Sharon was involved with the grant program for caregivers, the Respite Program.
As a respite provider, I take over for when the caregiver has to leave the home so that their family person and/or loved one has someone there to maintain a level of well-being. When I go to Catherine and Nancy's house, I do feel that the service, being a respite provider, would relieve Nancy from everyday stresses. It would give her many opportunities to go out and just enjoy activities that she may not have been able to. And also for Catherine, just to give her a diversion and an outlet.
Having Sharon be there eased a lot of the anxiety and the ill-at-ease feeling that I had. I would be preoccupied with, is she okay while I'm gone? And so once she stepped into the picture, that just kind of went away. I knew everything would be okay.
Our caregivers need support, and they need support right from the beginning. And in order to do that, we need to have more programs like the Partners in Caring program.
I feel so very, very fortunate to be a part of the Lifespan Respite program because the need is just overwhelming.
Caregiving is such a tremendous issue at this point in all of our lives because the baby boomers are moving into that age of greatest risk. And when they get there, we are going to be experiencing a shortage of caregivers, informal and otherwise. Lifespan is trying to get the word out, not only about caregiving, but of services and resources that are available in our community.
I didn't have any answers until I reached through to Lifespan. They came up with answers to things that I didn't even know I needed. And I think that was the best part. They're really professionals. And I think the best thing would be to say, they really care. They make you feel like this is a personal gift and helping assistance to you. So Lifespan was a real lifesaver for both of us.
Okay. So I want to touch on meaningful respite. How do you make this work? How do you bring it all together? And just as the caregiver in that video was discussing, how do you then help caregivers to help themselves? So meaningful respite is part of the assessment process and the follow-up contact with the caregiver. At the initial home visit to meet with the family and discuss the program and then determine a safe placement of volunteers, the caregiver is asked to explain how they hope to use their time. They don't always have a real clear understanding at that point, but we try to get a rough idea or at least get them thinking, because often, we're the first step of help that they've even allowed to come into the house. So, using their time can range anywhere from just being home with the care receiver and the volunteer, because some don't really want to leave the house and leave a new person with their loved one. But the thing that's good about that is that if the volunteer and the care receiver are sitting in a living room and talking for a couple of hours, the caregiver can then not have to worry about engaging and can go upstairs and read a book, put their feet up, take a rest, do whatever it is that they need to do. Some caregivers would say that, they want to go out with friends or go to some of their necessary appointments, doctor appointments or otherwise, or perhaps attend a class or an event. So this is a rough idea of what caregivers would say they would do at that time, or maybe even just run errands. So at the follow-up contact, we asked what the caregiver had done while the volunteer was there, and the caregivers were then encouraged not just to use their times for necessary appointments and necessary errands, but to also do something that is self-care and pleasurable for them, something that I think a lot of them had put on a back burner prior to their caregiving responsibilities growing. So caregivers are encouraged to attend powerful tools for caregivers classes where they learn to focus on some personal well-being so that they can continue to do a good job of taking care of their loved one. An example of one of our contacts after about a month of the volunteer visiting weekly was that the caregiver reported that each week when the volunteer was with her husband, she attended medical appointments for herself. She went for a physical with her doctor. She had blood work completed. She saw the dentist. She went to the eye doctor. She then said that she felt a little guilty about asking if it was okay if she went to lunch with her sister while the volunteer was with her husband. So we applauded her and reaffirmed that it was perfectly okay to do that. That is respite. It doesn't have to be so goal-oriented in terms of your to-do list, but something for yourself. So this brings us to the matching process. So the Lifespan Caregiver Respite Program is unique because our ability to tailor the match between the volunteer, caregiver, and care receiver is very specific, okay? So the program was evaluated by an outside evaluator on an annual basis, and the evaluation looks at how well the program meets the needs of the individual caregiver, also the care receiver, and whether it was meeting the needs for our volunteers. It also measures satisfaction levels and stress reduction. Data is collected at numerous points during the relationship. And what makes this service innovative and exemplary is not only the collaboration among multiple agencies, but the quality of training for the volunteers, as well as ongoing support and the thorough assessment of the caregiver and care receiver, and our ability to match volunteers in unique ways. I'm very proud of that. It's time consuming. I never thought I would be a matchmaker, but I will tell you, we all became matchmakers. So we determined what the care receiver is able and desires to do. Volunteers may take their care receiver to the movies. Maybe it's somebody who's into bicycling or walking along our beautiful walk paths along the Erie Canal, or just out for a drive looking at leaves. Other volunteers explored past experiences with the care receiver. Maybe they brought in a DVD or a video about a specific topic, or maybe books for reminiscing. It all depended on the care receiver's abilities and what they were still able to gain from the visit. So we paired a veteran with another veteran who had been a clinical psychologist prior to his diagnosis. Together, they began a veterans support group at a local nursing home. We had people, our volunteer and care receiver were actually providing and involved in another volunteer program for another agency. This was awesome. So this allowed them both to claim a sense of meaning and purpose in what they were doing. And our intent is always guided by the why for this program. What is our why? Our why is to honor and empower caregivers, care receivers, and volunteers so that they may enrich each other's lives. So we always try to keep that goal in mind. So this process starts with looking at family requests based on gender, the location of the caregiver and care receiver, and the volunteer. A lot of times, many of our volunteers were 60 plus, retired, wanted to do a little something to give back, but they didn't want to drive, 15 miles away from their home in order to do this. So, there were some very important factors that were involved in the initial assessment or the initial look for volunteers. We also looked at the times that families said that they would like some help and what type of respite they needed, as well as the availability of the volunteers. So once those criteria are met, we go on to more specific details, and we take into account personality of the caregiver, personality of the care receiver, and the volunteer based on personal contact with all three. We look at interests and hobbies, past experiences, and other social needs. And we also look at the comfort level with pets, or maybe smokers in the home, or other challenges. The volunteer's comfort level with the location, the driving distance, as I had mentioned, taking the client out or staying in with them, the time or the schedule of the visit. We also have had to look at people's political beliefs and other beliefs to make sure that everyone was comfortable with the climate that we're in right now. So staff will call volunteers and caregivers and care receivers to see if there's any wiggle room, if we're not finding perfect matches. And we look at the triad and make a few adjustments if needed. We consider the first few visits as a trial period, okay, for all, okay? And then we ask for honest responses as to whether or not they felt this was working. The same holds true throughout the whole match period. So as things change for the care receiver and what their needs and abilities are, everyone is encouraged to let us know so that we can make adjustments so that everyone feels comfortable. And matches are usually made by staff brainstorming with individual situations. So when we struggle with a match or matching a family, what we started doing a few years into the project was that we created a poster board that is a display at the volunteer staff meetings. And it's a tree with leaves, and it changes every season. Sometimes there's apples and sometimes there's snowflakes on the tree, but it's kind of like an angel tree at Christmas time or at the holidays. And each tree with the leaves contains general information about a care receiver that we're looking for a volunteer for. Because sometimes people can make a really good match on their own. There's things that we don't know about them that might be a good fit. So we let them take a look at it and say, I'm thinking of taking on a second match and this one looks good. And so then we talk to them about the details and see if it's a possibility. So that's another way to keep the match process going. And this allows volunteers to have input that staff may have missed during our initial interviews. And often there have been matches made this way that have been really successful. So I am going to stop now. And I know we're going to have a chance for question and answers later. I hope that gave you a rough idea of our program. And I think Kim is going to speak next.
First, we have Doris. So thank you, Eve, for a great presentation. We really appreciate it. And now I'm going to introduce the Caregiver Support Initiative with Kim Comiskey, and they received the Rising Star Award from ARCH. So Kim is the Program Respite Coordinator for the Alzheimer's Disease Caregiver Support Initiative. She helps connect those caring for loved ones with Alzheimer's disease or dementia to local respite providers in the counties that the initiative covers, which are the very rural counties of Clinton, Essex, Franklin, Hamilton, Warren, and Washington. Kim is a graduate of Siena College, where she earned her bachelor's in psychology with a minor in sociology. She's been working in human services for more than 15 years and is passionate about helping families obtain the care they need. Her goal as a respite program coordinator is to help caregivers feel less alone. Her hope is that anyone providing care has someone they can reach out to, whether it's through the Caregiver Support Initiative, a friend, a peer, or another community agency. So thank you, Kim, for sharing your time with us, and take it away.
Thank you very much, Doris. So I work for the Alzheimer's Disease Caregiver Support Initiative, as Doris mentioned. It is a Department of Health grant that was established in 2016. So it's a regional caregiver support initiative that provides $15 million a year to fund a network of 10 organizations across New York State, which deliver programs that support family caregivers caring for loved ones living with Alzheimer's disease and dementia. So the Center for Neurobehavioral Health, SUNY Plattsburgh, is who I work for, and we're honored to be one of those 10 organizations. Like I said, our team was established in 2016. We receive $1.5 million per year to assist with caregiver services. We're currently closing in on the end of our 5th year of the program, and we're awaiting official funding for next year. Next slide, please. So as I mentioned, it's a New York State Department of Health grant. That being said, there are no income or resource guidelines for any of our caregivers. They're not going to be charged for any of these services. The areas that we cover, those 6 counties, they are rural. We're in the northeastern New York. We cover from around Glens Falls, Hudson Falls, all the way up through our Hamilton County, Essex County to the Canadian border. So that just kind of paints a picture of the area that we cover. So the only criteria to be enrolled in our program is caring for someone with dementia or memory loss. If someone does not have a diagnosis, we are still able to work with the family. We can help get them the diagnosis. We work closely with the Center for Excellence, which is located here in Glens Falls, and we can send a referral over to help them along the way with that. The 6 counties that we do cover, as I mentioned, to paint a picture of how rural they are, when we were seeing families within their homes, some of our families are an hour to 2 hours away from us, just to travel to get there. So there's not a lot of services in between. So that being said, with our supports through this program, we really have to be creative in how we're helping these families. The goal of the program is to improve the overall quality of life for the caregiver and the dementia patient. In doing so, we hope to reduce the amount of trips to the ER and allow someone to live in their home for longer, at home where they're comfortable should they choose. And we also want to expand respite services in this area so that we can give our caregivers that much needed break. Next slide, please. So that's a picture of our office. That's our main office in SUNY Plattsburgh. And then we also have satellite offices. So the bottom picture, that's where I'm located. I'm at a satellite office in Queensbury. We've also opened satellite offices in Elizabethtown and Malone, and this has allowed us to expand services that we offer. We are a team of 11 that I will kind of get into all the different services that we do. But we have 2 co-directors, 5 care navigators, an education specialist, respite coordinator, and 2 administrative assistants on the team. Next slide, please. So before I get into our respite program, I want to cover all of the different services that we do. It kind of gives you a whole picture of everything that we do. We try to be an all-encompassing service to our families once we meet with them. So our intake is our first step. Our care navigators, we have a navigator assigned to each county. So that way the family gets to know them, they trust them, they'll reach out to them for supports and services. So that first step is our intake. It allows the navigator to gather important information, introduces our program, discusses other programs that may be within the community that they may see as something they could take advantage of. We're currently providing everything over the phone or virtual. We used to meet with families within their home. We would meet with them out in the community, or we would meet with them in our office space. After the intake process, we're available for care consultations and family consultations. And these are as needed and ongoing. So whenever a family feels that they need some support, they can reach out, talk to their navigator. Really being something as simple as they're just having a tough day and they need to speak with someone, or maybe they're looking for some other services and supports and they need some guidance. We offer support groups, again, also being offered virtually right now. We have 7 groups running each month. And our memory cafes, we used to do these again in person. This was, the Memory Cafe was a time for caregiver, care receiver to come together in a social event and be among others who are going through a similar journey. They're wonderful. We have music and art and usually food when we were in person. They're now virtual, which has still been great. We're offering some art programs. We've had some musicians on, and it's just a time to be together and not necessarily be talking about the disease, but just spending some time together and enjoying those moments together. It's a beautiful thing to see when we've had some live music. We've had couples that get up and dance together that may not have danced together in years, and it's just a wonderful event to host. We also offer education and training programs. We have Kristen on the team who is dedicated to offering those programs. I think she has probably 12 different education programs that she's currently offering. These can be done, she's doing virtual trainings right now. She can do them in a group setting, and she also offers one-on-one training for any family that is looking for additional information. They can meet with Kristen and do a one-on-one training. The other part of the grant that we do is Project Lifesaver. If you haven't heard of that program before, we work with our local sheriff's departments in each county. We're connected. We will help identify if somebody may be appropriate for the service. We can make the referral to the sheriff's department. In return, the sheriff's department will make referrals over to our program if they've met with someone that they think could use some more supports and service. And it's a locator device that is worn. As we know, there's, wandering is a real issue and a concern. So if a family member wants a little bit of extra help within the home, we can register them with Project Lifesaver. They then wear a locator device, which then we can call. It's a 911 phone call. The sheriff's department will come out and they can help track and locate that individual. So that being said, with all of those programs, respite is another big piece of this grant that we offer. So next slide, please. So our respite program is probably our most sought after service. We have families that call us all the time just looking for respite. Then we get to know them, we talk to them, and maybe they'll realize that there's something else that they want to use in addition to our respite. So that being said, our respite, we allocate approximately 25,000 respite hours per year. We put aside a good chunk of money towards respite. This is a paid respite program, which I will get into all of the details about our providers as well. But we allocate anywhere from $400,000 to $500,000 each year towards respite hours. So as of right now we're currently serving 343 caregivers, and they receive anywhere from 50 hours a year in respite to up to 250 hours a year, depending on their situation. So the first step that we do, as I mentioned, the intake, our navigator will meet with the family and go through the necessary paperwork to get them enrolled in the program and discuss all of our services. They will then also offer the respite program and talk about a respite application. So when they're meeting with the family, they're getting to know the family. They are providing a quality of life, completing a quality of life inventory with each caregiver. They will complete this at intake. They will also complete this 6 months to a year in. And really simply, it's a measurement of happiness. It kind of goes through a bunch of different life questions, and we get a feel for where that person is. It generates a score, so that way we can see how the score is going throughout the year. So hopefully at the end of this grant or the end of their journey with us, we can kind of monitor and see how these services have maybe helped. It also paints a picture for maybe they need some additional help and services within their life due to how they're feeling when they enroll in our program. So after we go through the respite information, our care navigator will bring out a respite brochure, which outlines our entire program. They will also go over different ways of using respite and our respite provider list, which I'll also get into. We are a voucher-based program, so once somebody puts the respite application through for review, I then create a certificate, which will give them a certain amount of hours that will be handed back to the provider, and then they have the choice to use those hours how they see fit. This program is a consumer-directed program. That means that we give our caregivers the choice about how they want to use those hours, who they want to use, when they want to use those hours, and the hours are kind of in their hands, and we help guide them along to make sure that they have everything that they need. It's extremely person-centered. The fact that it is consumer driven allows it to be a flexible program. So if somebody is looking for care on nights, weekends, evenings, they're allowed to get some help that way. We just kind of try to match them up with a provider that they may see fit that will work for them, but they get the ultimate say and choice in who they're going to use and how they're going to use it. Let's see. We do ask that our caregiver identifies somebody that they want to use. And again, I'll get into the respite providers. That's a whole nother slide of information, but we kind of walk them through the initial steps of trying to think about different ways that they would like to use respite. And before they apply for the service, we help guide them towards how they want to use it and who they want to use when they apply. Next slide, please. So as I mentioned, our respite providers, they are all independent contractors, and we will pay them directly. There's a lot of different ways that families can use respite within our program. So they have the choice to use consumer-directed respite, which means that they are choosing who they want. They've identified who they want. This can be a family member, a friend, a neighbor, word of mouth. Maybe a neighbor knows somebody else and they've got to know that person, so they can bring that person to us and we will have that conversation with that individual. We establish a contract and we will take them on as their own provider. That's very helpful for families if they're already comfortable with someone, they've already had them in their home. Sometimes it's just a friend that's already helping out, a neighbor that's already stopping in and sitting and playing cards or coming over for dinner. It helps. We're able to then pay that person as if they're willing to sign on with us. And sometimes it takes off the burden of the caregiver having to ask somebody all the time to come over. You know, we'll come in and say, well, what if we can pay them? Would they be willing to sign on and help out that way? If we meet with a family and they do not have anybody in mind, we do offer a provider list. We have established a list of individual providers that we've contracted with, as well as agencies that we've contracted with. Our current list is up to about 73 people, which is pretty good. We have contractors in each county that we serve. Again, with being rural counties, I think 3 of our counties do not have an agency housed within them. So it's kind of hard. This list is nice to have because if they don't know anybody, they don't have any friends or neighbors, anybody they're familiar with, we can also provide this list to them and they can go through the list. It's organized by town and area, and they can go right down that list and start making phone calls, and they can interview that person to see if it's somebody that they want to use. The other option, we've contracted with agencies. If a family, sometimes we'll meet with a family and they say, how am I supposed to trust this person? I don't know if I want to let this person into my home. Then maybe we'll suggest an agency that's on that list, because the agencies that we've contracted with, we will pay them directly for the service, but they have their own rules, regulations, training, and guidelines that they follow, and they will help place somebody within the home. So if it's challenging for a family, if we're feeling that it's a little bit too challenging for them to find someone on their own and they don't know anybody, we may guide them towards one of the agencies. They place the phone call to the agency, and the agency will walk them through who they have available, bring somebody out and introduce them to that individual. We have contracts with day programs. We are lucky enough to have 5 day programs within our area. Medical model and social model day programs. And we have also contracted with nursing homes. So we have established respite beds within local nursing homes. If a family wants to go away for a short term, like a vacation, they want to get away for a few days, or if they have an upcoming surgery, they may reach out to us and say, can we get a respite bed established? And we are happy to do that and offer that service. Next slide, please. So that being said, we're currently offering respite during a pandemic. It's been a challenge. We've luckily been able to continue our respite services without much of a break in care. The biggest challenge that we've had, all of the day programs closed in the beginning of the pandemic. So that was a huge change for a lot of our families. They like to use the social day programs for a day here and there to give the caregiver a break. When those shut down, those families were kind of at a loss. So we did work with a lot of those families trying to find an individual provider to come into the home instead. They could use their hours that way instead. We just now have had a couple day programs in our area that are slowly starting to open up. So we're starting to see that usage again. When everything hit, things did quiet down for a few months. We had about half of our caregivers put services on hold. The other half continued on. They knew the provider, they trusted the provider, they were okay and comfortable with them coming into the home. And because they're independent contractors, we could allow continuing to pay for those services. So we did offer the CDC guidance to our caregivers as well as our respite providers. We continue to let our respite providers know. We send reminders, do not enter the home if you are showing any symptoms, or if you have a fever, please screen, monitor yourself before you go into a home. And on the same respect, the caregivers that we're working with, we printed and laminated signs that they could post in their home so that everybody's on the same page of what to look for and what they would be comfortable with. It was individual choice. We left it up to the families if they were comfortable with it. And as I said, some put them on hold. And as we went into the summer months, we started to notice that more and more people were starting to use their hours. And right now we have pretty frequent usage of hours. I think when the weather changed, people were able to get outside and you were able to do a few different things, have a little more space during that respite care. So we have continued on, thankfully. The personal shopping is something that's completely new for us. We asked permission through Department of Health if we could add this in when we realized how isolated our families were and they may not be able to get out to get their groceries. We, with our contracted agencies, we allowed personal shopping as an option. So the respite provider was able to pick up some groceries and run some errands for the individual. We did limit this to just contracted agencies only. And then virtual support, our navigators are still available for our families whenever they need help. Those families that we have that are completely isolated, if they had a respite provider that was not comfortable coming into the home, we knew how important it was for that person to continue to be checked in on. So our navigators reach out, make sure they're doing okay. Even if they're not using their respite service during this time, we still check in on them, make sure that they have everything that they need. Next slide, please. Volunteer respite is something that we've been working on for a couple years now. I actually, when I started with the program, was a care navigator for our Warren and Hamilton counties, and then transitioned into the respite program coordinator. And when I did transition into that, we had volunteer respite into our work plan. And it's definitely something that we are excited about and that we want to pursue. We decided that we wanted to follow a drop-in respite program model. We've been working on it. We've come close 3 times now. We had a church that we were working with in this area. We were going to offer it once a month for 4 hours to have the safe space and volunteers. We had 6 volunteers all signed up, ready to go. And it would be once a month where you could drop off your loved one, go run some errands, go see a movie, have some time to yourself. And then we would have activities and different things that we would be offering during that time. That was all scheduled in April, and we had an open house scheduled for May. And unfortunately, that was completely shut down due to the pandemic. So this program is on hold. We have it set up where we have the funding within our program to be able to fund this. We were partnering with a program that had a volunteer coordinator, and she had volunteers in mind. We did the train the trainer with the REST program, and we plan to offer the REST training to all of the volunteers that would be participating in this program. So we were very interested in continuing to do this program when it's safe and when we can pursue this again. The REST training is something that we're definitely interested in, and we hope to be able to continue this in the future. Next slide, please. So that is our contact information. We're on Facebook and our website. And I know I did a really quick overview of our program. There's so much that goes into it, but we've had so many positive stories within this program. I think one of my favorite stories that sticks out in my mind, we had a caregiver who was getting married and taking care of her mother. And she had reached out to us asking for some respite hours because she knew that she was going to have a lot of planning coming up with her wedding and a lot of different things she needed to do. And she said, I really need someone to be there with my mom so that I can get all of this planning done. So we allocated some hours to her, and she called us after she used some of the hours, and she let us know that instead of having the respite provider stay at home with her mom, she brought the respite provider along with them. She brought her mom with her, took her dress shopping, took her wedding shopping, and just spent the entire day with her, and said that she never would have done that without the help through the respite program. And that definitely was thinking outside of the box. We're so used to somebody coming into the home and providing respite care, but this was such a beautiful story because she was able to spend such quality time with her mom, and the respite provider was happy to be there to assist during that day. So that was such a lovely story that kind of always sticks with me. But that's our program overview, and happy to answer any questions about the program.
Oh, thank you so much, Kim. I love that story. That's awesome. We do have a question, and I think it can probably apply to both Kim and Eve, and that is coming from Dina Prest at the New York State Office for Aging. She would like to know, is your intake form standardized? And is it only the care navigator that conducts the intake, or other people involved in that? So we'll start with you, Kim.
Sure. So we created the intake form within this program. It's the same intake form across the board through all of our counties. And our Care Navigator is our first point of contact within this program, and they are that ongoing support within the program as well. So they are the person that will complete the intake. Again, it used to be face-to-face. It was a great, sometimes it was a 1 to 2 hour meeting of going through everything, listening to their story and gathering demographic information. Now they're completing those intakes over the phone, and then we communicate past that point if they are looking for some respite care.
Great, thank you. Dina, do you have any other questions about these programs? No, maybe she's not there. Eve, can you tell us about your intake form, please?
So our intake form is also standardized. I'm not certain if I mentioned it earlier, but our grant, the original Helen L. Morris grant, was supposed to be a 3-year grant that started in 2013. It turned out to be a 6-year grant. And when the grant funding ended, it was picked up as the model that's being used for our Department of Health Alzheimer's grant, similar to what Kim was doing. And it is the in-home respite piece. All of it is standardized. The intake form is standardized. And I don't remember if there was another part to that question.
She wanted to know if it was just the Care Navigators who were doing the intakes, or was there anyone else involved?
Well, there are a couple of people who touch that intake process. The initial call is to the program coordinator, who evaluates whether or not they're appropriate for the program on a very general level. When you're using volunteers, there are certain criteria. There's no lifting allowed. There's no toileting or personal care in the bathroom. So the person has to be somewhat independent or not have those needs while the volunteer is there. So just the very basic questions. And then, moving into some of the standard questions, what are the needs of the caregiver? Tell us a little bit about the care receiver. What do you think you're going to do with your time? We always do some safety checks. This is something that's changed over some time, and I will have to look back into our manual, but some of the questions do include not only are there pets in the house, and are they friendly, or can you put them in the other room so no one gets bit, because that's happened, not in my program, but it's happened. Smokers and firearms. We always ask about firearms. Even if folks do have firearms, and Kim, I would imagine up in your area, there are a lot of firearms with hunting, but are they safely secured? That's really the most important question. So all of that is asked initially, and then moved into making that home visit appointment if they're appropriate, where we get into a lot of detail. And that's with the care managers who go out to do that visit.
Thank you both. So I have a little question. I recently attended the Arch Respite Research Summit, and there was a lot of discussion about whether or not any respite program should be asking what the caregivers are doing with their time. So my question to you is, do you find resistance at all for them, for you guys asking that? Because I know you both collect that data, and do you have any thoughts on that?
I'll start. We really don't get a lot of resistance. The way that we're established, our navigators really know the families very well. So when they receive a phone call from their care navigator, they're sharing a lot of information, and they really seem to be happy to share the information about what they're doing during respite. We also have a system set up where once we have a payment request system that comes through. So our caregiver is reviewing exactly what the provider is sending in as far as hours, and we keep them up to date on how many hours they have left and how many have been submitted. So even when we place that phone call to check in on those hours, families tend to let us know how it's going, what they used respite for.
Great. How about you, Eve?
No resistance at all.
Okay.
Never once in the 6 years with Helen L. Morris, and now with the Finger Lakes Caregiver Institute, almost 2 years. So over the 8-year time frame, people are very happy to share. And I think that some of that has to do with the relationship that you create with them and really allowing them to feel safe with the information that they're sharing. So
Right.
never
Right.
had a problem with resistance.
Well, sometimes I think researchers might overthink it. So I was just curious from the boots on the ground how you guys saw that. So I'm glad to hear that. The other piece is, well, I have two more questions actually. So Kim, you guys are big into the voucher model. And so do you have kind of a manual for that can be shared? Or
We don't
you're
have a manual, so we follow what was given to us with Department of Health respite guidelines, and we kind of go based off of those guidelines. As
Okay.
far as the voucher and everything that we've created our own certificate in that whole process. So we don't have an established manual outside of going through the Department of Health manual and following that system.
Okay, well, I may be reaching out to you on some of that information, so
Okay.
that would be great. And as for Eve, she showed you the replication manual in the beginning, so it's very well documented, the Lifespan Respite Program. It has been replicated, as Eve said, through the Department of Health grant. So if anyone is interested in having a hard copy of that, just you can shoot me an email through the website, or if you know me, or throw it in the chat box. But I will be sending out the replication manual via email if anyone would like it as well, along with a survey about this presentation. So look for that soon in your inbox. So are there any other questions out there? Is everyone unmuted, Sharon? All right, well, I don't see any more chats, so I'm going to just finish up with a few things. First of all, thank you, Kim and Eve, for sharing your time and your expertise and most of all, your passion, because the work that you do is not always easy, and we know you're having an incredible impact in the communities that you work in, and we do appreciate you for that. If you jumped on late, we do have CEUs available. You need to put in the chat if you want the CEUs. We do have a chat from Ann Scherf, who actually serves on our advisory board, and she says, thank you very much for presenting this interesting information. And we have other thank yous coming up too. So they've joined me in thanking you for your time and expertise. Like I said, if you need CEUs, please put it in the chat box. And also, I wanted to mention, Kim, you mentioned your drop-in center, and I know we've been keeping our fingers crossed for a really long time over that, but we did just put out another RFP for grants for creative respite opportunities. So on our you can find it on our website if you haven't seen it already, but the coalition just stands behind trying to creatively provide respite across the state, across situations, and across age and disabilities. So we definitely support all people and their caregivers with disabilities, not just the Alzheimer's folks, which is where your expertise is. I just want to tell you tomorrow, if you haven't seen, we do have a special event webinar with Daphne Johnston from the Alabama Respite Ministry. She has started respite drop-in programs using faith community partners all throughout the United States. And she will be doing a special webinar for us tomorrow. So if you want to get in on that, it's sure to be uplifting and inspiring. Go to the events page on the NYSCRC website and sign up. And anyone who attends will be receiving a free copy of her most recently published book, Reclaiming Joy. So if we have nothing else, do you ladies have anything else you'd like to share that you might have forgotten? Nope. Okay. Well, thank you all for joining us for our series on series for professionals working with caregivers, and we will all see you next time. Thank you so much. Have a great rest of your day.